So your book is set to be used in a bioethics graduate course at Case Western this fall, and you'll also be guest teaching at UPenn Medical School, also in bioethics. What is the connection there? How does that come about?
Yeah, so that was really what I discovered after writing the book, which was really surprising to me. I was trying to, find people who would be interested and kind of dove back into my book as a reader, trying to find themes. And what I noticed is that as a physician myself, some of the themes and situations that these healthcare practitioners, even though they were practicing under extreme circumstances and extreme stress,
Mhm.
you could kind of translate some of these situations to today's medical world, and particularly in the world of bioethics. For example, there's dual loyalty, which is a concept of bioethics, sorry, where one is torn between two loyalties. It can be a bit for the patient when you're a doctor or a nurse, but it can also, you have to be loyal to the institution within which you are working. And when I gave some talks at hospitals and for the book release in Maimonides in Brooklyn, a lot of the physicians there, some of them worked in the ER, others didn't, but in different departments, but a lot of them gave the examples of dual loyalty towards the patient and towards the insurance companies. Yeah,
Mm,
so they want to give this medication, but it's not going to be paid for by the insurance
right.
companies. So these are issues, and there are many other examples. A lot of literature is written about this in prisons or in military ethics.
So what's
Uh,
the dual loyalty at the Jewish hospital?
well, one of the examples that I use is a scene which is really brilliantly told by my grandmother. So I kind of transcribed it. As a very young nurse, she was asked to go work in the emergency room, which was not her usual place where she was working, because at the time they were starting deportations from Berlin, and a lot of the Jews would get these deportation slips
Mhm.
with telling them they would be deported the next day,
Uh-huh.
and in some cases, people were so desperate, even though they didn't know what would happen to them, a lot of them tried to commit suicide, and they would be brought to the Jewish hospital and to the emergency room. And a lot of the times, the Gestapo would come and linger around and wait for these people to be revived so they could then deport them, it makes obviously no sense when you say it this way. And the
Right.
dual loyalty in this case is the loyalty of the healthcare practitioners towards the patients, but also, which, you want to do what is best for the patient. So you want to treat them, but
Uh-huh.
knowing that they're going to be deported, you also
Right.
don't want to treat them, but you have to be loyal to the hospital, which is under the supervision of the Gestapo. So doesn't
Yeah.
have the best outcome of the patient at heart.